Well, I was injured at work. I fell, I stepped, wasn't aware of my surroundings. I stepped backwards and basically tripped into an empty parts bin. And in trying to catch myself, ended up basically sitting on my hand. Tore the tendon off my right thumb, broke my right ring finger in a couple of places, I guess.
So when Alan presented, initially his injury didn't look too bad. He had a small cut on the back of the thumb and a swollen finger. But when you inspected him further, we realized that his ring finger was actually mal-rotated, so it was not going to make a normal fist. And his thumb actually had a small cut, but it had managed to go through the important tendon that extends the thumb and even into the joint of the thumb, which put him at risk for infection afterwards.
Dr. Calfee was the doctor who was on call. He was busy with other folks at the time. There were people there much, hurt with me, or than I was, but they were constantly referring to him. People that were running off, taking with him, coming back. They were excited about, and that's when I learned that the tendon was gone. They were excited about, because you could see the bone. They were excited about the fact that it was an open wound. Didn't know whether they wanted to, they were going to take me to surgery right away or not. This, that, and the other thing. They decided to go ahead and just clean it out after a while, and schedule me for surgery then later.
So Alan was able to go to the operating room that day directly from the emergency room because of the nature of his injuries. And what we did was, in the operating room, explore the thumb and realized that the open injury did indeed go into the joint and completely cut the tendon. And so we washed the injury out to decrease the chance of infection. We were able to repair the tendon, actually having to put it back into the bone because he had actually sliced it off of the bone, and then repairing the joint to stay in place. We then examined the ring finger and were able to do what we call a closed reduction. So without making an incision, we were able to line up the bones and get the finger properly aligned, and then place a small pin across the bone to help hold it while it would heal.
I've never really had bad experiences with any doctor, but I broke my left wrist about 4 or 5 years ago. I worked with a different orthopedic hand specialist at that point, who was also very good, different hospital, and that kind of stuff. But Dr. Calfee, I would recommend him to anybody at all, because he was just right there with you and didn't try to fool you. Told me exactly what was going on and what I could expect and what I needed to do, to make the best recovery I could.
So post-operatively, Alan healed all of his wounds nicely, and he was very compliant with rehabilitation, which involved protecting the joints of the thumb and the ring finger for several weeks before starting gentle motion and then more aggressive therapy after everything had healed. I feel fortunate that we were able to explore Alan's wounds and appreciate just how severe they were. I think that if we would have missed this type of injury, he would not be able to extend the thumb and may have suffered from a more severe infection that really could have threatened his thumb and his hand function.